Full questions for Rick, and then we'll move on to Coach. Go ahead, Rick.
Okay, as everybody knows, Patrick was injured on Sunday night. He had a significant left knee injury on a non-contact hyperextension injury. Immediately following the game, we came down here and did an MRI. That MRI revealed an ACL injury, anterior cruciate ligament, and a lateral collateral ligament injury. That lateral collateral ligament you may see as a posterior lateral corner because there's some other structures back there that constitute that. After that, our doctors, Patrick, his family, his agent, consulted, and then we sought out a second opinion, and the family and agent and Patrick and everybody agreed that he would go to Dr. Cooper in Dallas. Dr. Cooper set him an appointment for him Monday morning, Monday afternoon, and then operated on him Monday night. The reason he wanted to operate on him quickly, where we usually wait on the ACLs, is because the LCL, we wanted to reattach the avulsion injury there. As Dr. Cooper told us after seeing the MRI, and my doctor saw it, they said everything that he had in this injury was fixable, correctable, and it was fixed on Monday night by Dr. Cooper. He had no artery damage, no nerve damage, no joint surface damage, no meniscal damage. He's already started rehab down in Dallas. He was there first thing Tuesday morning, and he'll do that through tomorrow, and then he'll be back here Friday. As you know, in the past with Patrick and his injuries, he attacks them and does very well, and he's in that mode right now. I've talked to him every day. I know Coach has too, and he's already on it. He'll return here Friday, and for the majority of the rehab, he'll do it with my staff, and in particular, Julie Freimeyer, who's done his dislocated patella, his toe injury, and his ankle injuries. Anybody have any questions?
So you did know then that night that there was an LCL injury?
Yes,
Okay.
yes. But we wanted to wait until they actually got into the need to disclose that it was that have them examined and everything, to make sure that we had all the right nomenclature on that injury.
Sam?
Rick, I know you don't know the timeline yet, but can you give us a sense of like how the steps or the boxes are checked on any player, just generally speaking, with an ACL?
Yeah, so it is a good question. It's coming up a lot. Every player's different, every sport's different, every position's different, and with him, traditionally, he's going after it so hard, and he's so in tune with what he does that he does it a little quicker. Ballpark on this thing is 9 months. Could be a month or two less, a month or two more. You never know what goes on, and everybody's designed differently biomechanically, and so you just have to go through it, and then he's got, position-specific things that he needs to do. So right now, I'll give you this, early on in the rehab phase, we're doing a lot to get his muscles firing and get the swelling down, and he's in a protective brace right now so that all that surgery heals in.
All right, guys, we're going to go last two, Todd, and then Pete. Go ahead, Todd.
Rick, in today's world, are there new advances in recovery that, weren't there 10, 15, 20 years ago that you can take advantage of now?
Oh, of course, there's new techniques out there surgically, and I think the bigger and faster these guys are, the more you see injuries like this, and so the doctors are better doing it, and certainly we all selected a doctor who's done this surgery in the past, and he did some techniques based on what was there, which are unique to the case. So sometimes you have to use a graft on the lateral collateral ligament. He didn't have to do that because he's got advanced techniques. And then the same way with rehab. I mean, we've gotten a lot better at rehabilitation, and the athlete's gotten way better at nutrition and recovery and all the things that go with it.
Last one, Pete.
You've seen a lot of players, and you've rehabbed Patrick before, I guess. Where does he stack up, just generally speaking, about ability to recover maybe faster than average?
Yeah, I think, as you guys know, as a player, his mindset is a little different than most. He's so regimented at what he does. He's in here at 6 a.m. He's the last guy out at night. He'll take the rehab like that. He and I talked about, listen, you have a schedule right now in season where you get treatment at this time, rehab, or film at this time, practice. That's how rehab's got to be, and that's how it's always been with him, and it will. And when you add up all the little things, that allows the player to get back faster. They don't heal up any faster. They just get back to performance faster.
Good. Thanks, Rick.
Thank you, guys.
Thanks, Rick.